If you're having chronic knee pain and stiffness, you may be dealing with knee arthritis. Hi, I am Dr. Sebastian.
And I'm Floyd. I'm the PA working here at Integrative Rehab Medicine.
And this is Bob, our skeleton. Today we're going to talk about arthritis of the knee, what it is, how to diagnose it, and best of all, how to best treat it. So the knee joint has this layer of cartilage inside, which is a smooth gliding layer and allows the knee joint to move back and forth. Unfortunately, with knee arthritis, this cartilage gets damaged.
So it's going to happen with aging, it's going to happen with repetitive movements, and it's also going to happen with specific injuries, and that's where you're going to get that damage to occur.
So basically, when this cartilage is damaged and cracked, the joint becomes inflamed and it becomes swollen and stiff. So what are some of the symptoms of knee arthritis?
Most common symptom is going to be pain and stiffness, especially first thing in the morning or if you've been sitting for a long period of time and you go to stand up. Also, a lot of people are going to feel clicking and grinding. Sometimes they'll even get swollen and inflamed, but those are going to be the most common symptoms people have.
And patients sometimes also complain of the knee giving out. If they're going up or down the stairs, sometimes the pain or just the swelling can cause the knee to give out. So the next thing we need to do is to diagnose it. So how do we diagnose knee arthritis?
We're going to do a physical exam. We're going to see how the knee joint is moving and feel how much crepitus is in there, which is that crunching sensation that people can feel. And then we're going to get imaging. We're going to get x-rays and we're going to get MRIs. And that's going to show us exactly what's going on inside the joint.
So using the x-rays and MRIs, it can actually show the joint space and it can show if the joint space is narrowed or decreased. And that signifies that the cartilage has been damaged and then the joint space goes down. There are a lot of treatments for knee arthritis. The standard of care treatments are using non-steroidal anti-inflammatory medications or steroid injections. Unfortunately, these are not very good. They come with side effects like kidney damage with the non-steroidal anti-inflammatories or even damage to the joint. Every time you get a steroid injection into the joint, it can actually damage the cartilage even farther. So we typically don't recommend it. In our clinic, we use regenerative medicine treatments such as prolotherapy, PRP, and stem cells. So can we talk about those a little bit, Floyd?
So prolotherapy are going to be injections with dextrose. So dextrose is sugar water. PRP is going to be platelet-rich plasma. So it's where we take your blood and we have a lab and we process it. So PRP and prolotherapy are going to be used for more mild to moderate arthritis. When people have more severe degenerative changes, when we see inflammation in the bone itself, or when people have more significant meniscus tears or damage to the soft tissue, the ligaments and tendons, then we end up using stem cells here.
So these cells, like the platelet-rich plasma or the stem cells, actually stimulate a healing response. Pretty quickly, they decrease the inflammation, and then they stimulate the body to start healing the joint. Very often, there's some ligament laxity or injury to the ligaments and the meniscus and other structures. So what we do is we also inject those. Using an ultrasound, we can see exactly where a needle enters, and we use the stem cells and the PRP to treat those structures as well. And that allows that whole knee structure to heal. But there's other things that we also do, such as physical therapy to strengthen the knee joint. We can recommend specific diets like anti-inflammatory diets, and sometimes some supplements like glucosamine chondroitin or turmeric. So if you want to find out more about non-surgical treatments of knee arthritis, you can click the link below, scan through our website, and give our clinic a call.